Anjeso as part of your multimodal regimen. Anjeso is indicated for use in adults for the management of moderate to severe pain, alone or in combination with non-NSAID analgesics. Because of delayed onset of analgesia, Anjeso alone is not recommended for use when rapid onset of analgesia is required. Anjeso is an NSAID, and like all NSAIDs, it has a boxed warning relating to cardiovascular and gastrointestinal risk. Non-steroidal anti-inflammatory drugs, or NSAIDs, cause an increased risk of serious cardiovascular thrombotic events, including myocardial infarction and stroke, which can be fatal. This risk may occur early in treatment and may increase with duration of use. Anjeso is contraindicated in the setting of coronary artery bypass graft, or CABG surgery. NSAIDs cause an increased risk of serious gastrointestinal or GI adverse events, including bleeding, ulceration, and perforation of the stomach or intestines, which can be fatal. These events can occur at any time during use and without warning symptoms. Elderly patients and patients with a prior history of peptic ulcer disease and/or GI bleeding are at greater risk for serious GI events. Pain is the result of a complex interplay between numerous signaling pathways. Multimodal analgesia employs multiple mechanisms of pain control to help improve analgesic effect and is becoming the standard of care for pain management. Unless contraindicated, guidelines recommend the routine use of around-the-clock non-opioid analgesic regimens to ensure continuous coverage for post-operative pain. Around-the-clock dosing is thought to result in enhanced pain control by providing more stable plasma levels of the analgesic agent and can minimize delays in administration associated with as-needed dosing. When considering a multimodal analgesic approach, it is important to choose pain management options that are right for you and your patients. Anjeso is the first and only once-daily IV analgesic. Anjeso provides up to 24 hours of pain relief and has demonstrated safety and tolerability across multiple procedures. When initiating Anjeso, monitor patient pain response. If patient experiences inadequate analgesia during the 24-hour dosing interval, consider adding a short-acting non-NSAID immediate-release analgesic. Anjeso is a COX-2 preferential IV NSAID, a drug class that is recommended as part of a post-operative multimodal pain management regimen. The mechanism of action of Anjeso, like that of other NSAIDs, is not completely understood, but involves inhibition of both COX-1 and COX-2 pathways. COX-2 activity is based on in vitro data, not clinical trial data. Anjeso is available as a ready-to-use 30 mg per 1 milliliter vial. No refrigeration is required, and it does not require reconstitution. Anjeso is administered once daily via an IV push over 15 seconds. Dose adjustments are not required in patients with mild to moderate hepatic impairment or mild renal impairment. Consider non-opioid Anjeso as an essential component of your multimodal analgesic regimen. Important safety information. Warning: risk of serious cardiovascular and gastrointestinal events. Cardiovascular risk. Non-steroidal anti-inflammatory drugs, or NSAIDs, cause an increased risk of serious cardiovascular thrombotic events, including myocardial infarction and stroke, which can be fatal. This risk may occur early in treatment and may increase with duration of use. Anjeso is contraindicated in the setting of coronary artery bypass graft, or CABG surgery. Gastrointestinal risk. NSAIDs cause an increased risk of serious gastrointestinal or GI adverse events, including bleeding, ulceration, and perforation of the stomach or intestines, which can be fatal. These events can occur at any time during use and without warning symptoms. Elderly patients and patients with a prior history of peptic ulcer disease and/or GI bleeding are at greater risk for serious GI events. Contraindications. Anjeso is contraindicated in patients with known hypersensitivity, for example, anaphylactic reactions and serious skin reactions to meloxicam or any components of the drug product, history of asthma, urticaria, or other allergic type reactions after taking aspirin or other NSAIDs. In the setting of coronary artery bypass graft, or CABG surgery, moderate to severe renal insufficiency patients who are at risk for renal failure due to volume depletion. Warnings and precautions. Hepatotoxicity. Elevations of ALT or AST have been reported in patients with NSAIDs. In addition, rare, sometimes fatal cases of severe hepatic injury, including fulminant hepatitis, liver necrosis, and hepatic failure have been reported. Inform patients of warning signs and symptoms of hepatotoxicity. Discontinue Anjeso immediately if abnormal liver tests persist or worsen, or if clinical signs and symptoms of liver disease develop. Hypertension. NSAIDs including Anjeso can lead to new onset of hypertension or worsening of pre-existing hypertension, which may contribute to the increased incidence of cardiovascular or CV events. Patients taking some antihypertensive medications may have impaired response to these therapies when taking NSAIDs. Monitor blood pressure. Heart failure and edema. NSAID use increased the risk of myocardial infarction or MI, hospitalization for heart failure, and death. Avoid use of Anjeso in patients with severe heart failure, unless benefits are expected to outweigh risk of worsening heart failure. If Anjeso is used in patients with severe heart failure, monitor patients for signs of worsening heart failure. Post-MI patients. Avoid the use of Anjeso in patients with recent MI, unless the benefits are expected to outweigh the risk of recurrent CV thrombotic events. If Anjeso is used in these patients, monitor for signs of cardiac ischemia. Renal toxicity. Long-term administration of NSAIDs has resulted in renal papillary necrosis, renal insufficiency, acute renal failure, and other renal injury. Anjeso is not recommended in patients with moderate to severe renal insufficiency and is contraindicated in patients with moderate to severe renal insufficiency who are at risk for renal failure due to volume depletion. Correct volume status in dehydrated or hypovolemic patients prior to initiating Anjeso. Monitor renal function in patients with renal or hepatic impairment, heart failure, dehydration, or hypovolemia. Avoid use of Anjeso in patients with advanced renal disease, unless benefits are expected to outweigh risk of worsening renal function. If Anjeso is used in patients with advanced renal disease, monitor patients for signs of worsening renal function. Anaphylactic reactions. Meloxicam has been associated with anaphylactic reactions in patients with and without known hypersensitivity to meloxicam and in patients with aspirin-sensitive asthma. Seek emergency help if an anaphylactic reaction occurs. Exacerbation of asthma related to aspirin sensitivity. Anjeso is contraindicated in patients with aspirin-sensitive asthma. Monitor patients with pre-existing asthma without aspirin sensitivity. Serious skin reactions. NSAIDs, including Anjeso, can cause serious skin reactions, including exfoliative dermatitis, Stevens-Johnson syndrome, or SJS, and toxic epidermal necrolysis, or TEN, which can be fatal and can occur without warning. Discontinue Anjeso at first appearance of skin rash or other signs of hypersensitivity. Hematologic toxicity. Anemia has occurred in NSAID-treated patients. Monitor hemoglobin or hematocrit in patients with any signs or symptoms of anemia. NSAIDs, including Anjeso, may increase the risk of bleeding events. Monitor patients for signs of bleeding. Drug interactions. Drugs that interfere with hemostasis, for example, warfarin, aspirin, SSRIs, or SNRIs. Monitor patients for bleeding who are concomitantly taking Anjeso with drugs that interfere with hemostasis. Concomitant use of Anjeso and analgesic doses of aspirin is not generally recommended. Angiotensin-converting enzyme, or ACE inhibitors, angiotensin receptor blockers, or ARB, or beta blockers. Concomitant use with Anjeso may diminish the antihypertensive effect of these drugs. Monitor blood pressure. ACE inhibitors and ARBs. Concomitant use with Anjeso in elderly, volume-depleted, or those with renal impairment may result in deterioration of renal function. In such high-risk patients, monitor for signs of worsening renal function. Diuretics. NSAIDs can reduce natriuretic effect of furosemide and thiazide diuretics. Monitor patients to ensure diuretic efficacy, including antihypertensive effects. Adverse reactions. The most common adverse reactions in controlled clinical trials occurring in greater than or equal to 2% of patients treated with Anjeso and at a greater frequency than placebo include constipation, gamma-glutamyl transferase increased, and anemia. Use in specific populations. Pregnancy. Use of NSAIDs during the third trimester of pregnancy increases the risk of premature closure of the fetal ductus arteriosus. Avoid use of NSAIDs in pregnant women starting at 30 weeks gestation. Infertility. NSAIDs are associated with reversible infertility. Consider withdrawal of Anjeso in women who have trouble conceiving. Please see full prescribing information, including boxed warning, at www.anjeso.com. For a once-daily non-opioid treatment, go with Anjeso. Visit anjeso.com/product-ordering for ordering information.